Hello, I'm Michael A. Weiss. Welcome to the Patient Perspective 2-Minute Drill, where the play for today is how to approach a doctor appointment. First off, how do you choose a doctor? Everybody wants to see the best, whether it's a recommendation from your mom, your dad, your sister, your brother, someone at work, but you need to see and find the right doctor for you. And that's especially important today because healthcare has become more collaborative in nature than ever before. And it's a collaboration between doctor and patient. So you got to get along with your doctor. So try to choose wisely. Try to find some compromise between who you feel is the best and who you feel is the best for you. Next up is preparing for that initial visit, whether it's the night before or a couple of days before, and especially if your patient history warrants it, try to put together a chronological listing of significant events that have happened regarding your medical problem. And by that I mean surgeries, hospitalization, the medications that you're on, any adverse drug reactions that you've had. Be succinct as possible because you want to be as respectful as you can of the physician's time. As you prepare for this initial physician visit, get a pad. Write down some questions. Try to be logical in the order in which you ask them. And try to list some answers to logical follow-up questions that your physician will ask after he or she looks at your patient history and examines you. It can make things go a lot smoother. Now let's talk about the actual visit. Try to get there a little bit early so that you could observe what's going on. You want to observe the people in the waiting room. You want to observe how they're being treated by the nurses and the receptionists. Bring an iPod or some other listening device or a book to read. It'll make the time go by faster. If it is a long wait and if it is unreasonably long, keep in mind that something could have happened. An emergency might have happened. And then the physician and his or her staff would have to change everything and reprioritize everything. Now, I know that that might sort of get people frustrated and even angry. But keep in mind that one day that emergency is going to be you. As you interact with the physician, pay careful attention to whether they're utilizing their most valuable tool, which is their ears. They need to listen to what you're saying. You need to feel comfortable that your doctor is listening to you because the most innocuous details could become important. After the exam room, usually what doctors will do is they'll have you meet them in their office. Maybe not immediately, but maybe 5 or 10 minutes later, where they go over what they're going to prescribe for you or what they think is wrong with you or what you should do. Ask him or her about how they go about medication refills, how they go about faxes. Can you fax them status notes about how you're doing? Do they ever use email? Do they use social media? Do they ever have Skype chats with patients? Now, you don't want to ever overdo it or give them the impression that you're one of those patients who needs to speak to the doctor every day, but try to find out this information because it'll really help you. And with that, we conclude the Patient Perspective 2-Minute Drill, where the play was how to approach a doctor appointment.